Okay, today we're going to talk about sleep disorders. I'm not going to cover all the sleep disorders, but I'm going to focus on a couple of them, which I think that may be tested more in the exam, and you may need to know about that. So sleep is like cornerstone for our health. Yet, like any disorders sometimes go unnoticed. So we will explore two, narcolepsy. Imagine falling asleep uncontrollably in middle of the meeting or during an important family event. This is daily reality for many individuals with narcolepsy. So patient always feel need to sleep during the day, no matter how much rest they get at night. And you think about like cataplexy, which is a symptom where you have sudden loss of muscle control triggered by strong emotions like laughter or anger. And then there is sleep paralysis also. It's a terrifying experience where the person wakes up but is unable to move their body. So you want to treat it with sometimes with modafinil. You can do scheduled nap and sleep hygiene. So modafinil is a medication which promotes wakefulness, helps patients stay alert during the day. Scheduled naps are like, short planned naps during the day can significantly impact the daytime excessive sleepiness. And maintaining sleep hygiene would be like, maintaining regular sleep schedule where you're minimizing disruption is essential for managing. So while narcolepsy is characterized by unpredictable sleep attacks, hypersomnolence, which is another one, presents itself own set of challenges. So hypersomnolence, when you think about hypersomnolence, you want to think about have you somebody who just couldn't wake up no matter how much you slept. That's how hypersomnolence feels like. Like, for example, somebody sleeps for 10 to 12 hours, but still feel tired and difficulty waking up, even with an alarm, waking up feels impossible. State of grogginess that lingers after waking up and it impairs the daily functioning. In these cases, stimulants work, that is, amphetamine can help with combating drowsiness. Adopting regular physical activity and sleep schedule also helps. And you want to think about what factors lead to this in kind of like contributing factors. You want to think about sleep apnea can play a role sometimes, depression, chronic pain, thyroid issues, poor sleep habits, irregular schedule, lot of screen time, caffeine and alcohol, and sometimes environmental issues like noise, temperature not being correctly set. All this can play a role. How do you treat it? Sleep hygiene, CBT, relaxation, regular sleep schedule, and stress management. I want you to specifically think about cataplexy, which can be tested in an exam, which is sudden loss of control. You want to think about modafinil, that can be asked in the test. In hyperstimulants, think about stimulant therapy. So these are the things you want to remember. Thank you very much.